everyone. Welcome to the new episode of INLINE, decodeMR's podcast. In this episode, we address the complexities surrounding persistent cough that lasts for more than 8 weeks, chronic cough. I'm Vandana Shetty, and I'm delighted to be joined by Dr. Abhishek Uday Kumar, who is a pulmonologist from East Point College of Medical Sciences and Research Center, India. Doctor, thank you very much for lending your time and expertise to our podcast today. We are truly honored to have you here, and I'm very much eager to gain valuable insights from your perspective on chronic cough.
Yeah, thank you. Thank you for having me here.
Doctor, let's begin with discussing about the most common causes of chronic cough and how do you typically approach diagnosing them in your patients?
Yeah, so chronic cough, it can be a little tricky. So you can say cough is chronic when it's there for more than 8 weeks. So when you're having cough for more than 8 weeks, you have multiple reasons. Okay, so but worldwide there are 4 most common causes. Okay, so one is the post-nasal drip. So that is upper airway cough syndrome. So it's like when you're having sinusitis or anything, whatever extra secretions are there that get accumulated and it can cause cough. And one more, the second one will be asthma. So asthma later, obviously it has got a complex evaluation and later treatment is a bit elaborate. And other than that, we also have our non-asthmatic eosinophilic bronchitis. So that is bronchitis associated with increased eosinophils. And last but not least, the most clinically common, we see chronic cough associated with GERD or gastritis. So each one of these have their own individual treatments. So early we should start with the history examination. Usually we have to rule out smoking or even use of certain antihypertensives. So later, based on the history and symptoms, we can start evaluation.
And could you also explain the potential complications or underlying conditions associated with a persistent cough that lasts for more than 8 weeks?
So chronic cough can have multiple complications. So one of the most you can have complications of maybe rare ones like esophageal rupture, and it can also cause increase in intra-abdominal pressure. So patients who have undergone surgery or patients who are about to have any surgery, it's going to be a risk for them. And other than that, in general, cough itself, it can be depressing. So you have quite a few psychiatric problems associated with it, and also the social stigma associated with the person who's continuously coughing all the time. I didn't get the second question. The question had 2 questions, right?
Yeah, what are the underlying conditions associated with this cough?
So like I told you, like we have multiple things. So you have like infective conditions. Maybe infective conditions, chronic is usually rare because an underlying infection will be acute or subacute. But yeah, sometimes it can present as chronic, maybe even tuberculosis or anything. But again, non-infective also, you have different causes, like it can be any malignancy or anything. So other than that, before going to such serious conditions, obviously we have to rule out sinusitis and asthma and eosinophilic bronchitis, and last but not least, GERD.
Right. And as you said about various causes of chronic cough, which is not very well defined, I understand that diagnosis of this condition is not that easy, right? So how do you differentiate between a cough caused by environmental factors like allergies or irritants versus one that may be indicative of a more serious underlying condition?
Yeah, good question. So a lot of patients, they have a lot, maybe atopy or because of allergic symptoms, they can be having cough. So again, we have to differentiate that with more serious conditions like maybe a malignancy or even something like tuberculosis or something like that. So again, simple X-ray would be the basic screening test, and to see whether if there's anything major, any infection, consolidation, or maybe even a mass that is seen. So again, or before we go for an X-ray, we can just start the patient on some basic treatment, maybe cough suppressants, or if the patient is having productive cough, an expectorant. So based on that, and we can wait for the patient to respond. But usually, when the patient is having chronic cough, the norm is to get chest X-ray. Obviously, history can be a giveaway. Maybe a history of smoking or history of use of antihypertensives is a direct giveaway for the cause of cough. So again, we'll have to investigate it even if none of these, even if the history is negative. So and again, if the patient is not even if the patient is having a normal cough, a chest X-ray, and later if the patient is having no relevant history, we'll have to go for further investigation. So maybe something like, for example, GERD, we can get an esophageal pH monitoring or maybe an endoscopy. And again, for allergies, we can get a sinus, allergic rhinitis, we can get a sinus imaging. And HRCT is obviously one thing. And if everything's coming normal, we can go for a bronchoscopy and BAL and send it for analysis. So we also can rule out cardiac with a 2D echo. And environmental causes, we can subject the patient to a simple CBC with eosinophil count and maybe even an IgE test later on. And lastly, we can go for a skin prick test or immunoblood test for allergies.
Right. And as we discussed about the multifaceted causes of chronic cough and differentiating them based on different tests, I would also like to explore avenues for managing this persistent symptom, doctor. So could you comment on what are some lifestyle changes or home remedies that individuals with chronic cough can try before seeking medical intervention?
Okay, so before seeking medical intervention, maybe if the patient is having known allergies, maybe if the patient is allergic to certain type of oils, a certain type of food, avoiding such things. Or maybe if the patient is allergic to dust, avoid using woolen blankets, avoid using carpets at home, avoid having pets at home. Maybe short-haired pets are fine, but especially the long-haired pets are difficult to deal with. So yeah, and if the patient is known for having allergies, depending on where they stay, also like a city like Bangalore, maybe it has huge pollen in the environment. So such things, such times, so patient can maybe use a simple mask or something like that. And if patient is using AC or air conditioning or something, the post-nasal drip can worsen. So avoid using air conditioning. So yeah, so based on the history, we can advise basic things for the patient to avoid and do.
And adding on to that, can you also let us know what are your suggestions and advices to manage this condition during seasonal changes or heightened environmental allergens?
So environmental allergies, so it is better to actually get yourself evaluated. So maybe getting a skin prick test done or even a PFT done. So initial treatment can be given maybe an inhaled corticosteroid or a bronchodilator, and after that we can slowly, when the patient improves, we can get a PFT or maybe a skin prick test. We can even get something called pheno, that is a fraction of exhaled nitric oxide, to see if the patient is having any allergic symptoms. So also lifestyle changes for patients with GERD. So use of PPI or even improvement of diet and avoiding consuming food like just before sleeping. So we can do all these things.
That was really insightful, doctor. And I'm sure that these tips will be helpful in navigating the challenges posed by chronic cough.
Yep.
Doctor, now let's talk about another important aspect of chronic cough management, because I understand that there are a lot of medications available for this condition. But for patients who have already tried various treatments without any success, what further steps or specialist referrals might be considered in their care plan?
Yeah, so that will be based on the patient's history. So if the patient is maybe having associated gastritis, maybe an investigation into the gastritis is helpful, maybe an endoscopy. Okay, so if the patient is having allergic CBC and eosinophil count is maybe raised, we can get a PFT done and we can start the patient on inhaled corticosteroids. And again, maybe even leukotriene antagonists or antihistamines can also help with the patients. And also, if the patient is already a known case of maybe asthma or allergic rhinitis, we can check the compliance of the patient. So if the patient is actually taking the tablets, and also there'll be a need for critical assessment of the patient if the patient is not responsive to anything. Further assessment, like I previously said, with HRCT or bronchoscopy.
Got it, doctor. And as you said, I think it's very important to assess the adherence of patients or the compliance of patients, whether they are adhered to the treatment or not, and that makes a difference. And looking towards the future, what areas of research do you believe hold the most promise in advancing our understanding and management of chronic cough?
So nice question. So there are multiple places where research is needed. So I feel again in allergies we can there's these latest before the standard used to be a skin prick test. So now you have your immunoblot tests for different allergens, which is easier. Just it's a lab test where you can send your blood and you can get your allergy panel done. So that's much less painful than your skin prick test. So I feel research in the immunoblot test is right. And again, research into the different gastritis-induced cough is also useful. Again, maybe correlation of gastritis and early ILD. So to rule out maybe an indication of ILD, we can just look into that. And also the different drugs which maybe decrease the empirical treatment. So what kind of empirical treatment is useful for which phenotyping the patients. So maybe a phenotyping of the different patients with chronic cough will help us in better understanding and treatment of these patients.
Right. And lastly, what key message or advices would you like to convey to individuals who are experiencing a persistent cough and are unsure about seeking medical attention?
Yeah, so first and foremost, I would advise them to go for their lifestyle modifications. So, like I said, avoiding dust, having early dinners, avoiding sleeping with just after having dinner. So, and again, use of masks. So, and avoiding use of air conditioning, especially when they're having such conditions. So that in the beginning, but again, there is being in India, we have the greatest threat, that is tuberculosis, which usually presents as subacute to chronic cough. So ideally, the patient should approach a pulmonologist or a general physician so as soon as possible, and get themselves a basic evaluation. So rather than taking over the counter drugs. So that would be my take home message from this.
Thank you so much, Doctor. That was my last question to you. And as we wrap up this discussion, I would like to once again thank you so much for your contribution to our discussion on managing chronic cough. And your insights have really added depth to our conversation, and we appreciate your time and knowledge.
Thank you.
And to our listeners, stay tuned for more engaging topics in our future episodes. Until then, this is Vandana signing off. Take care.